Welcome back, and thank you for tuning in to Naijha Speaks. I'm Naijha Wright-Brown, co-owner of the Land of Kush Vegan Soul Bistro in Baltimore and executive director of the Black Vegetarian Society, also contributing for Jane Unchained News. Today's topic, we're talking about health care waivers for heart attacks, health waivers for heart attacks. And we're looking at heart disease in the United States. It's the leading cause of death. One person dies every 36 seconds. 655 Americans die from heart attack each year, one in every four deaths, and it's costing the United States about $219 billion each year. My guests today, who do we have on the panel, are Dr. Milton Mills. We had this discussion and you launched this concern. He is an internist featured in What the Health, Invisible Vegan, and also the newest documentary, They're Trying to Kill Us. We have Nivi Jaswal, former corporate executive and also founder of JIVINITI and Virsa Research Foundation. Gwenna Hunter, founders of Vegans for Black Lives Matters. Willie Flowers, executive director of the Park Heights Community Health Alliance in Baltimore, and also president of the NAACP Maryland State Conference. And Jane Velez-Mitchell, award-winning journalist, author, and founder of Jane Unchained News. Thank you, and please welcome our panelists. I want to start with Dr. Mills, because this is how this all started. You sent out a post. Should those eating meat have to sign a waiver saying if they have a heart attack, they will sit home and die and not burden hospitals? Can you talk to us about why you said that?
Well, obviously, I was attempting to be somewhat provocative.
Obviously.
Yeah. And I sadly, I noticed that my Wi-Fi is like being a little strange now. It's freezing up. Okay, there it goes. But there was really a very deep kernel of truth to that question, and that is that the link between what we eat and the diseases that result from the foods that we choose to eat have been really well researched, delineated, and it's pretty clear now that there is a direct link between a diet that is heavily based on animal foods and development of not only heart disease, but cancers, high blood pressure, diabetes, and other health problems. And so my question was meant to get at the idea that if people continue to behave recklessly, to intentionally eat things that clearly are unhealthy and that they know are unhealthy, should they be willing to simply accept the consequences? Because I'm really frustrated, both as a physician and just as a person, when I hear people make these flippant, glib comments like, "Oh, well, I'm a carnivore," or I just like whatever, dismissing the potential consequences of the choices that they make. And so my question is that if you really do, quote unquote, love bacon or love whatever it is that you feel you can't live without, are you willing to die for it? Because
well, I looking at this map, I don't know. We'll get to this later. I guess they are.
Well, I see. That's the thing. I don't think they are. I think that they ignore or try to pretend that those risks don't really exist. As the expression goes, denial ain't just a river in Egypt. And then as soon as the consequences start to happen, then they want to be taken to the hospital. They want, hundreds of thousands of dollars to be spent trying to save their lives, when what they did was entirely foreseeable. So again, my question is, should you sign a waiver saying that, hey, if I begin to suffer the inevitable consequences of my choices, I'm willing to accept that. I knew what I was doing going in, and I'm just going to not burden the American taxpayer and the healthcare system. And I'm just going to sit here and take what's coming to me. Or conversely, you might say that you will absorb entirely the full cost of treating this disease again, because like someone driving drunk on the highway, what you did was reckless and foreseeable, and therefore you should have to be responsible for all of the consequences that stem from those choices.
Thank you for that, Dr. Mills. I want to hear from everyone on the panel. Willie, do you want to give us your thoughts about this?
Sure. Certainly. Thank you for inviting me to.
Froze there. We'll move on to Nivi, and I'll come back to you.
I
hear him. Yeah.
Okay, we all frozen here. I know I'm frozen.
James,
I think you're frozen.
Okay. Here's the other gentleman. He can talk because we're here.
Yeah, we can hear him, and we can see him as well.
Okay, I'm sorry about that.
Right. So I guess thanks for letting me chime in this very interesting conversation. And I was trying to follow the Dr. Mills, and I certainly was trying to figure out if he was just trying to be provocative or if he was trying to be a medical professional in this discussion. I couldn't come to any conclusion. So I'll just say this, that this whole thing about what people die from, how they die, what they eat when they die, the information is not balanced. So we can't take what I think is an arrogant position to say that someone needs to sign a waiver if they choose to eat meat or not. So I'm not in the very linear category of people who don't eat animal protein, who thinks that people who eat animal protein should go off somewhere and die when they have a medical emergency. I'm looking at the doctor's office, and he has flammable furniture in his office. Are you willing to sign a waiver that says if something catches fire in your house, that the fire department shouldn't come because you have knowledge of the retardant chemicals that are in all of those the furniture that you have in your house? I'm sure that you won't be willing to sign a waiver, but you're asking, I guess in this tradition of being provocative and shocking, the Howard Stern of vegan doctors, to get across to people who don't know the details, particularly Black African people. And I can't speak for anyone else, but our history in this country is made of a lack of information, a lack of access to information, and then a lack of diversity on how that information gets to us. So if anybody's going to sign a waiver, there shouldn't be one African-American person to sign a waiver. And he didn't put that in there to be provocative, so I'll be provocative. Because of the history of medical technology, the history of information about medical technology, if his waiver is to be considered, take Black people out of it. So that's my provocative statement. And we should be, as people with the information, should spend more time getting the information to people in these communities so that they'll have the information. And that's not the case right now. We don't have enough resources. We don't have enough organizations to go into communities. And in organizations like mine to do this type of work, you don't have enough time.
I appreciate that, Willie. I want to just hear everybody's thoughts on the discussion, Dr. Mills.
So you want to hear everyone before I respond to that? Because fine. I'll come back. I'll wait.
Thank you. I appreciate Dr. Mills. Gwenna, Vegans for Black Lives Matters. Okay, what's your thought on this?
Well, when you first presented me with this, it was like a hard no, and it's still a no. However, I can understand why a person would feel motivated to feel this way. One, I think that we have to have grace and mercy for people's personal evolution, because what if this decision was made before you became vegan and before you came into the knowledge? I went to a cow vigil last week, and I felt like I did when I first became vegan and learned all about the morality and animals being conscious, and I was fired up. never thought I would hold a sign again that says stop murdering. And I did. Like, it was so urgent to me. So I think it just really depends on where the person is coming from when it comes to the opinion of this. But for me, I'm all about grace and mercy for people having their journey and their evolution. I do understand it's urgent. It's a burden on the healthcare system, but so is it with people that smoke cigarettes. There's not a person alive that doesn't know that cigarette smoking is bad for your health. Drinking alcohol, even though it's quote unquote legal, we know that it's a huge toxin to the body. So should we deny them of care? People that are addicts, should we deny them when they come into a hospital because they've overdosed? So this could lead into a lot of dangerous territory, but I do have understanding for why, Dr. Mills came with this approach.
Thank you for that, Gwenna. Can we hear from you, Nivi?
Yeah, sure. I know, I actually completely relate with what Gwenna just mentioned, that Naijha, when you shared this topic with me, my first thing was, are you sure Dr. Milton Mills said this? Was he just trying to be provocative, or was he, sharing this as a healthcare provider perspective? I'm pretty sure it can't be the latter. But, thank you so much, Dr. Mills, for sharing that you were, saying this to be provocative. And I'm looking forward to hearing your perspective on this more. But, when I think about this, I hear you on the frustration. I hear you about the urgency of, shaking people out of this daze that they're in and being reckless and, irresponsible and so on. But here's the thing. The research and the knowledge that you have, that everyone on this panel has, it takes time to turn into consumer understanding. And I think that this is a classic case that even, Willie just mentioned, of lost in translation, where we have a plethora of research studies that have been done that prove conclusively that an animal predominant diet is severely unhealthy for human beings. But then is this translated well enough when we look at, advertising, when we look at consumer advertising that is not just made by private corporations, but also by the government itself? And to the map that you had earlier shown, Naijha, if you can pull it back up. When I look at this, at the JIVINITI research program, we've done a lot of secondary research as well as primary research. And it reminds me of a map from the Economic Innovation Group. And when we look at this map, it correlates very heavily with places that could be considered in two aspects. One is places that are low-income zip codes in the United States, and number two, places where the population happens to be disproportionately that of persons of color. So once again, agree with Willie that, keep persons of color, especially the African-American community and the Black community, out of this waiver, should this ever even become a reality. And I would like to share that I think access to healthcare is a fundamental right and should be available to everyone, and especially those amongst us who are more mesmerized and seduced and psychologically vulnerable to the suggestion that is made about consuming animals, for any reason, in the name of nutrition to them. And if we deny them access to healthcare on top of the access to good, responsible, ethical advertising and information and awareness, that would be the biggest tragedy there ever was.
Thank you for that, Nivi. And Jane, you want to weigh in here?
Yes. First of all, I understand why Dr. Mills is so frustrated, because you are shaking people and saying you're killing yourself with this diet, and basically tell you to buzz off. And then when they get sick, if you say, well, you're not a pure victim, you're a participant. You created the situation by eating food that created an entirely preventable disease, heart disease. 1 out of every 4 people prior to COVID died of heart disease. By the way, COVID is also, in all likelihood, stems from our abuse of animals. Either the animal was a bat to a pangolin who infected or cropped up at a wet market, which is a slaughter market in Wuhan, China, or even if that unlikely lab possibility is accurate, that was the abuse of bats who were taken from the wild to be experimented on. So either way, it relates to our toxic relationship with animals. Our toxic relationship with animals is at the root of almost all of our problems. It's at the root of our climate problem. Animal agriculture is a leading cause of greenhouse gas emissions. It is arguably one of the leading causes of water pollution, drought, and of course, let's not forget human world hunger. We're 7.9 billion humans consuming 80 billion land animals every year. Those animals are eating a huge percentage of the food that could go to hungry children who are in the third world dying of hunger and malnutrition as we speak. If more than 75% of soy is fed to farmed animals, if we took that soy and fed it directly to children, we could wipe out world hunger. How do you create profit? You create profit by having scarcity. How do you create scarcity? By reducing the amount of the product. It's the law of supply and demand. So we could live in a world of natural abundance where everybody has everything they want to eat and then some, but we're creating artificial scarcity with the meat and dairy industry, which is also having a horrific effect upon our planet and having a horrific effect upon human health. 1 out of 4 people dying of heart disease. Let's put COVID aside for a minute, even though that is animal-based as well. But 1 out of 4 people dying of heart disease, that is, unless you're one of the rare people with a genetic predisposition to high cholesterol, because you have high cholesterol plaque in the form of plaque clogging your arteries to your heart. And that plaque comes from animal products. You can go to the supermarket and go up and down the aisles and look for cholesterol in vegan products or plant-based products. You will not find any because plants do not produce cholesterol. Animals produce cholesterol. So I see it here in my own neighborhood. I see people barbecuing steak, and then in the wintertime, the ambulance comes up and they go out in a gurney, okay? And they never come back. It's tragic. And when you try to go up to them and say, hey, would you like a blueberry? No, they don't want it. So I understand the frustration. And we are also getting to a critical point of no return. We are barreling with our foot on the accelerator to a point of no return in the climate crisis. And you see it now with the massive floods that have hit Belgium, Germany, India, parts of California or the Southwest, Arizona, and China. It's happening everywhere. You have the wildfires, you have the drought. Just today, the Sacramento Bee did a story about, dairy farmers have to liquidate their cows. That's the word they used, liquidate their cows, because the feed prices are going up because of the drought impacting the crops. And the Cattlemen's Association leader said it's like a moonscape out there, meaning that the farmland is decimated. And yet that same association did everything it could to kill a piece of legislation that would merely provide a pilot program to help farmers and ranchers transition from dairy to some kind of plant-based product. So they want to take and eat it too.
Wow.
And here's the sad part is that, and I was talking mostly to Willie, so it's sad that he's gone.
Yeah, he's coming. Willie's coming back. We're bringing Willie back in to the stream.
Yeah, I don't know.
Back
I don't know when you dropped off of what I was saying. So hopefully you heard some of it because it's mostly directed at you, since I would be otherwise preaching to the converted on this panel. But the point is that this is the most self-sabotaging habit in the world. I speak as a recovering alcoholic with 26 years of sobriety. Okay? One day at a time. I have not had a drink in 26 years. I had a very bad habit and I defended it to the nth degree. I hated anybody who told me, oh, you had too much. You better stop. I didn't want to hear it. Okay? I didn't have the gift of desperation yet. When I finally hit bottom and I got the gift of desperation, that's when I had a moment of clarity and became willing to listen. This habit of animal consumption, which, by the way, doesn't even stem back to the original histories of most Americans. I'm Puerto Rican. If you look at the Puerto Rican diet, it would be, and I'm also Irish, potato famine, potatoes, cabbage, turnips. On the Puerto Rican side, yuca, maíz, black beans, rice, plátanos, fruits, vegetables. For us as people of color to be defending a diet that was imposed on us by colonialism is the height of self-delusion and self-denigration. If you look at here in LA, we have Little Ethiopia, vegan, because the Ethiopian marathon runners who could outrun all of us were on a almost exclusively plant-based diet. So we have to free ourselves from the brainwashing, the colonialist brainwashing that tells us, you defend this diet. It's your right to kill yourself. No, I applaud Dr. Mills for throwing a little hand grenade in this conversation to get us, to shake us out of our complacency and denial.
Well, thank you for sharing that, Jen, because we're moving into people being responsible for their decision making. And I just want to share my story about how I became vegan. And it was because of cholesterol. So you mentioned a lot about the cholesterol. At 33, my cholesterol was high enough for doctors and internists, by the way, Dr. Mills, to say if I didn't do something about it, I was going to be placed on meds at 33. And I'm holistic. I see a holistic care specialist. I've been seeing one for over 15 years. They practice traditional Chinese medicine, and I couldn't be in the best health ever. I see a physician as well, and she says I'm the only one in her office as a client that is not on medications. So I want to bring it to Dr. Mills. You wanted to respond to Willie's concern or what he was saying. So do you want to do that now, as we're talking about people being responsible for their eating habits? I can't hear you, Dr. Mills. You're muted. You got to unmute yourself, Dr. Mills.
Let me unmute myself. Now you can hear me, right?
Yes.
So I want to say first and foremost that I assure you that the furniture in my bedroom/office is not made of gasoline and is not unduly or irresponsibly flammable. So in that respect, I am not being reckless in the things that I have chosen to surround myself with. And it's very interesting to hear myself sort of cast as a modern day Joseph Mengele, which is really, I don't think, accurate or appropriate. But again, this post grew out of my hearing people interacting with people who, upon hearing about the dangers of animal-based foods, their response was a glib sort of, devil may care. Well, I'm a carnivore and I love this and I'm going to eat this. Well, again, if you are a person who willingly and deliberately places yourself at risk, then you need to accept that risk and you need to become responsible for that risk. And again, if you're not willing to sign the waiver that says, just let me sit at home and die, then you should sign the alternate waiver that says whatever costs that are incurred with treating my reckless behavior, I'm entirely responsible for. And that actually would be the case if, let's say, I had a room full of, you remember when the gas went up and people were putting gas in plastic bags and doing all sorts of idiotic things? Well, yes. If I had a room full of plastic bags and they suddenly burst and caught fire and burned everything I had and even endangered my neighbors, you better believe that not only would my insurance not pay for that, but I would be both criminally and financially responsible for that reckless behavior. Now, let me move on to this idea that Black people are these poor little witless, no name people running around without, any knowledge whatsoever and no understanding whatsoever. I reject that depiction of Black people as being so, deluded and so in such poor possession of our intellectual faculties that we can't even figure out how to open a door. I myself grew up in the inner city, in the ghettos of East Oakland, and I, am where I am now through seeking out information, through working hard, through studying, and that is something that I think is available to all people to a greater or lesser degree. Now, again, I'm not discounting the fact that African Americans and other people of color find themselves in onerous circumstances where they don't have access to some of the options and information that others have. But that's actually even more important in my mind, why an even stronger argument for this waiver. Because if people had to sign a waiver, either agreeing to sit up to simply accept the negative health consequences or to assume all of the financial responsibility for treating the consequences of what they eat, it would force them to say, wait a minute, why do I have to sign this waiver? Why am I being forced to take on this responsibility? What is it that is so wrong with what I'm choosing to eat that I am now being required to assume this kind of financial and personal responsibility? And that would force them to educate themselves even further. And with respect to people having a right to healthcare, yeah, I do believe that people have a right to healthcare, but then, that all turns on how you define healthcare. And the fact of the matter is that poor people will never receive the same quality or degree of quote unquote healthcare that wealthier people will receive. And that if you allow people of color, Black people, to stay on this death train that we've all been loaded onto, where people are eating hamburgers, bacon, and all other sorts of unhealthy, death-dealing compounds, dairy, cheese, you name it. Even if they have theoretical access to healthcare, it is not going to be a functional access to real healthcare. And the best way off that death train is through education, information, and understanding that what we eat directly determines the diseases we get. And I tell people all the time, no one on this panel, nobody listening to this podcast asked for fried chicken, ice cream, pork chop, or steak in the delivery room. All the things that people think they need or they can't live without, someone taught them to eat that crap. And just like they were taught to eat unhealthy things, they can unlearn those bad habits and learn newer, healthier ones. And that is the way to save our community. That is the way to save our people. Look, of all the people on this panel, I'm the only one that's dealing with the business end of the American diet in clinics, in the hospital. So I'm the one who knows what I'm talking about. Furthermore, I have spent my entire career educating people about
I want to give Willie a chance to respond to that.
About the importance of changing their diet to improve their health. So I just want to make it clear. And then lastly, I'm not only an internist, I'm a critical care doctor. So I actually deal with people who have heart attacks, people who are in the hospital with pneumonia from COVID or other problems. So look, I know what I'm talking about, and I'm saying we got to do something to stop this death train.
Okay, but Willie, thank you for that, Dr. Mills. Let me say one thing. When Dr. Mills talked about teaching, I was just out of school today, high school today, allowing the youth to try. Matter of fact, this was an agricultural youth group, allowing them to try vegan soul food for the first time. And the thing is that they don't know. This was the first time they were trying it. They gave their testimony. Some loved it, some didn't. Some didn't like the greens, but yeah, I think it is an educational thing. Willie?
So, first of all, I certainly want to respond to Dr. Mills, and I'll just say this, so you can understand the grassroots aspects of this, because you're waiting on people to come to your practice. Some of us are in the community, and I just want you to know that people don't care how much you know, since you know so much, until they know how much you care. And with that as an opening point, I just want to share with you and everybody else that if we don't pattern a way to meet people where they are, so this information can be shared with them, you're going to be speaking to the choir, and you're going to continue to speak to the choir, and nobody's going to be helped. With respect to this misinterpretation of what I explained about access points and equity challenges with any information, I find it quite odd that the doctor could express that healthcare was imbalanced, but he tends to believe that the information is not in balance. You can't have both. So I guess my stance is that in this whole vegan, vegetarian world, that we tend to believe that people are going to have the same religion that we have just because we have it. It's good that everybody on this call is either a vegan or a vegetarian or meatless or whatever terminology we use. But it's the case that if you want to be the example, be the example, but don't assume that people are going to just automatically adjust their entire lives just because we had some experience. And let me share with everyone here. I'm from one of those red states, and I grew up eating everything that they threw in my face until not only did I see people in my own family die, and I thought that it could have been reversed if they just stopped eating meat, but that's a challenge to do with our own family members, more or less the community. What's her name? Velez-Mitchell explained, Mr. Velez-Mitchell explained that she had members of her community having barbecues. I mean, can you save your own community just because you're a vegetarian? The point is no. The point is that there's extreme advertising that supersedes anything that we could ever do for the reasons highlighted earlier. But the reality is the only thing that we can do is empower ourselves and empower our organization so we can be better stewards, but also give better information so people can come along. But it's not going to happen overnight, and it certainly doesn't happen with a waiver. And are we also saying that everyone who is a vegan or a vegetarian is going to live forever? And the answer to that is no. We're not better than anyone else. We just have better information to live our lives in a way that gives us confidence to share this information, and that's our role.
Thank you for that, Willie. Gwenna, what do you have to say? Because I know you're doing a lot of things in the community. And Willie, you mentioned meeting people where they are. That's what the Black Veg Society's approach is, and I think we're doing pretty good with that approach. Gwenna, what do you want to say about what's going on in your community and how you're addressing the issue?
Yeah, so like Dr. Milton Mills, I grew up in the hood. I didn't leave the hood till I was like 20. Didn't even know I lived in the hood until I left it. And so like the food program, and I grew up in a food desert as well. The food programs I managed are all like Compton, Inglewood. You know you're in the hood when you're on MLK Drive. Like everybody knows MLK, no matter what city is the hood. So I'm always touching and talking to people and having conversation. And what I keep finding that is so consistent over and over, some people really just have no clue. You know, one time I went to Louisiana on a vegan food event for like HBCUs, and I went to a Taco Bell and asked her to make it vegan. And she asked me, what was that? And so I thought maybe she just didn't understand because maybe my dialect was a little different. And I spelled it, and she's like, what is vegan? I've never heard of that word before. And so that really humbled me because I realized some people, this conversation isn't even entering their atmosphere.
Right.
So many people have no clue about the harms of dairy. Like I always try to, when I do certain events and I'm showing videos, I always go to Milton Mills' videos about dairy and let people know about the racism and the toxins and the harm, because he's one of the only people that really give it to you hardcore, like some of us need it. So, you know, again, I know it's urgent and I understand, because if you would have caught me on the day of that cow vigil, I'd be like, yep, make them all sign a waiver. But also at the same time, you know, I'm doing these programs multiple times a month, and I'm definitely no ER doctor. I can't even imagine what that experience is like. But I do know some people really are freaking clueless, really have no idea.
I'm glad you said that, Gwenna, because even when I was at the school, I asked if anyone has tried vegan food or if they knew what vegan was, and they didn't know. I said, well, if you've had a banana or apple or nuts or seeds, things like that, you're being vegan. So it is an educational gap and just understanding. And with all the technology we have these days, we can just Google it. Nivi, what do you have to say about this places of responsibility?
Yeah, since everyone's talking about, where they grew up, I grew up in India. And I know that South Asian culture is completely blinded with faith in this idea of smug vegetarianism. They believe that, we must be superior because we don't eat meat. But hey, what about dairy? And I know that one of your viewers just posted what Earthling Ed said, that the dairy industry is, in fact, the meat industry, right? So in the outreach work that my nonprofit does back in India, as well as here in the United States, we've discovered exactly what Gwenna mentioned. People don't know. People don't know what vegan might be. People haven't heard about it. When you say, plant-based, they don't really get it because there's this whole emphasis on protein, what Willie was talking about, that the media and the media determinants of health are just so strong around the world. I remember I grew up with the Indian version of the Got Milk campaign. Now, that Got Milk campaign, if we have to really talk about effectiveness of advertising and converting people and, dazing them and keeping them mesmerized in the name of nutrition, that ought to get like the biggest, award of them all. And what we have here are now vegan athletes, the Williams sisters. And they, at one point in time in 1999, when this advertising came out by the PEP, which is the milk processors, organization in California that actually is responsible for funding these ads. Naomi Campbell, that's from 1993. This was the first ever print ad that Got Milk campaign and the Milk Mustache, ever did. When we look at such selective targeting, and there you go, another one. And when you look at the contexts, right? The contexts are, sport. Contexts are again, real sports star, celebrity influencer holding a bottle of milk, and sporting that mustache, and so on. And the reality is that piece of advertising, that campaign, has been the longest running campaign ever. And they have done more damage to a lot of this world's population, including the BIPOC population in this country, that is inherently lactose intolerant. And I hate using that word, Naijha, by the way, because a majority of the world is lactose normal, which is that we're not able to digest, metabolize, milk, and we're not even able to metabolize meat. So to speak. So all of,
but it is forced upon our communities, especially if you're in subsidized programs. Because I couldn't even get my daughter in a program if she didn't drink milk. So obviously she wasn't going to be in that program because she wasn't going to.
Yeah, absolutely. And if you don't mind, if I take a minute about talking about this Got Milk campaign, and just to talk about what they did during the pandemic, this program, the Got Milk campaign, was actually revived in the United States during the pandemic. And the milk processor education program, their CEO actually said, and they're funding the campaign, they said that cow's milk ticks the boxes of what consumers are looking for during a pandemic: comfort, nutrition, stability, versatility. And social media research showed them a 40% increase in positive mentions about milk in the year when the United States was dealing with a global pandemic. And sales of milk actually went up. It was the biggest year-over-year jump of 21% in March of 2020. And this was around the same time when we had 22% positivity rates in New York City. Can you fathom that? That is, when Willie talks about the extreme advertising, that is the power of the stimuli that is thrown at everybody, and especially in a very profiled and a targeted manner at communities of color.
Thank you for that, Nivi. Jane, if you can weigh in this a little bit, because I know when we talk a lot, you question, why the community is supporting companies that may back Trump and things like that. Do you want to shed some light on that?
Well, yeah, I think it's a case of selective indignation. We're getting all angry about Dr. Milton Mills suggesting that there be a health waiver. Okay, maybe that's a little over the top. If even if somebody was driving drunk the wrong way on the freeway, if they crashed their car, even if they killed other people, I would still try to get them out of their car. I wouldn't want to just watch them go up in flames. So I understand the criticism, but where is the indignation over what's being done to the kids? Children developing obesity, type 2 diabetes, cancer. The World Health Organization has determined that processed meat is cancer causing. Okay? The World Health Organization has determined that red meat is a likely carcinogen. Where is the indignation over our government forcing these cancer-causing products down the throats of kids? I'm very excited that there's a new movie called They're Trying to Kill Us, which outlines that they are intentionally feeding, particularly communities of color, food that is horrific. It's going to get them sick, fat, and nearly dead, so they can turn around and feed them all these pharmaceuticals. The meat, dairy, and pharmaceutical industry might as well be the same industry. People wouldn't need the erectile dysfunction pills, the cholesterol pills, all these other pills, the acne pills, if they were eating a whole food plant-based diet. So I would urge everyone who thinks, oh, shocking that Dr. Milton Mills would make such a horrific suggestion. Okay, we get your point. But by the same token, where is your outrage over what they're doing to our kids? Kids who don't even know what a frigging vegetable or fruit is. Kids who will cry. I sat down at dinner with a kid who was overweight, maybe 11 years old. And I said, because I made the dinner, here's some vegetables. And he didn't want to eat it. He wanted to eat some junk food that he normally eats. And I said, no, this is what you're eating. And he started crying. And I thought, this poor kid, he is condemned. He started crying because he did not want to eat a vegetable. That's the monstrous world we have created. And when I say we, I mean corporate America, conglomerates. And the irony is the people who are being hurt the most are the most fierce defenders of their right to essentially kill themselves. Now,
thank you for that, Jen. Let's let Dr. Mills weigh in on a little bit.
I want to say one other thing.
Okay, for the sake of time.
About privilege.
Okay.
Privilege. We are all decrying privilege today, as we should. There's white privilege, there's male privilege, there's all kinds of privilege. There's also carnistic privilege. What is the essence of all privilege? A, you don't know you have it. It's like body odor. You can't smell it when it's yours. B, the second definition of it is that you regard a minor inconvenience as a major violation of your rights. This minor inconvenience that we're asking people, instead of going for the breast milk of cows when you're looking at a container, just pick up another container that's oat milk or rice milk or hemp milk or soy milk or cashew milk or any of these other milks. Oh, you can't tell me what to do. Well, guess what? This milk is destroying the planet, polluting our waters, creating drought, causing world starvation, and this milk does none of the above. So the fact that you're considering that to be a real imposition means you suffer from privilege. I'm done.
All right.
Thank you for that.
I gotta dispel another misconception about me that was thrown out there. The statement that I sit in the hospital and wait for my patients to come to me. I have been doing over 40 years of community-based education. That is, in fact, what led me into medicine. And I don't have time to go into all the things that I do and have done at the community level to educate people. But let's just say I've been doing this for over 40 years. I'm out in the community meeting people face to face. And then the other thing is that I need for people to sort of let go of their righteousness and their desire to vilify me and actually think about what I said. I didn't say that if somebody eats meat and has a heart attack, we just throw them in the backyard and let them, writhe around till they croak. I said that people should have to sign waivers saying that if they choose to eat an animal-based diet, that they will either, one, agree to just let the heart attack take its course, or two, that they will assume all financial responsibility for the consequences that result. The whole point of that is that it forces the individual to educate him or herself about why they are being required to sign that waiver. See, so unlike sitting around feeling sorry for people and saying, oh, these poor people don't have information and therefore they can't be held responsible. No, if you are being forced to, when you go anywhere and they tell you, well, before I can let you on this ride, before I can let you perform this activity, you got to sign this waiver. The first thing you want to know is, why am I being required to sign this waiver? What risk am I assuming by doing this behavior? It's all about informed consent, which happens in the hospital. Before any procedure, you have to be told what the risks versus benefits are. And then with that knowledge, you sign the waiver if you agree to go ahead with that procedure. And that's my point, that forcing people to sign a waiver will force them to educate themselves. And again, that is sorely needed within our community, because I'm telling you, when our people go to the hospital, they don't get the quote unquote best of care. And even if they did, that care does not save lives. Studies show that all of the stents we place, all of the bypass operations that we perform do not extend lives. Furthermore, a Black person having a heart attack is much more likely to actually die from that initial event than a Caucasian American. So many of us don't even get to the hospital to get those stents or those bypass operations. So that is why this, like I said, I'm the one on the front lines. I'm the one seeing the business end of this diet. And I'm telling you that, the time for being polite and politically correct is gone. We need hardcore measures to force people to confront the dangers of what they're doing to themselves, and sitting around making excuses saying, oh, that, they don't know. Oh, I know that people are being misled and that there's advertising that is set out to deceive. But I also know that there's a lot of information available to educate people, because I'm doing a lot of it. A lot of other people are doing it. And the whole point is, you tell that person, if you're going to eat this cheeseburger, you got to sign this waiver. They're like, wait a minute, why? Why do I have to do this? And then that's when you say, because it will raise your risk for cancer, heart disease, diabetes. And if you want to understand why, you go and watch Forks Over Knives. You go and watch What the Hell. You read this book. You educate yourself so that you will learn how to avoid these diseases, instead of just sitting around watching people fall off the damn cliff and say, well, it's not their fault because somebody pushed them.
Well, thank you for that, Dr. Milton. And I'm going to let you say something, Willie. I can just say, I know when I was afraid, I was young, and I had to take responsibility to do something about it and educate myself. And, I don't know, is the law of the medical industry that it's just money in the medicine and there's really no cure? I don't know. What do you have to say, Willie? What did you want to say about it?
No, I think that this loud talking, and he said righteous indignation. That's not what I do. I think my goal here, and I'm not trying to be provocative, I'm not trying to scream in the phone. I can share with you that I've never had to be on any medicine all my life. I've never been in the hospital. I actually spend more time tending a total of about 1.5 acres of land so that I can produce food for people in a space where they can have convenient access to chemical-free food. And I've been doing that for about 9 years now in 2 communities. I don't just do it in a urban area of Baltimore City that I love, but I also do it in the suburban area where I live. That I don't think that these health disparities that we talk about stop at the city limits. So it was important for me to expand that type of access into 2 areas. So the notion that I don't have a clue about how to be on the front lines, and I don't even want to be defensive about anything, and like other people on this phone have been, I'll just say that it takes everything to do what we're all doing, and to present something that Dr. Mills said himself, an attempt to be provocative. You shouldn't be defensive when someone else tries to display that while there is a lot of information out there, everybody doesn't get the information. I take it as my role to share information in a different way. I take it as my role. I don't diminish what Dr. Mills is attempting to do. I just want to highlight that there are more than enough people that don't have the quality information that we all have, and we must figure out a way together to expand that information. And so to be in a position of attack mode all the time because you're defensive is not a way to step away with a call to action for us to continue to work so that we can frame something so there can be understanding about these details. I'm a civil rights activist. So in doing that, and in the history of civil.
Thank you for that, Willie. Okay, we have less than 10 minutes. I want everyone to just go around and tell people where they can follow you. What is the solution from your point of view? What's the call to action? What do we need to be doing? Me, go to blackvegsociety.org. Blackvegsociety.org. We're meeting you where you are. Come down to the Land of Kush, landofkush.com, please, and check out interviews on Naijha Speaks, naijhaspeaks.com. That's my call to action to everyone. And I'm going to continue doing what I'm doing to help the community. Let's go with Nivi.
Okay, thank you so much, Naijha, for this opportunity. To find me, please go to JIVINITI, that's JIVINITI on Instagram, and as well as on LinkedIn. We do behavioral research programs. We're a nonprofit based out of the Boston area. And I'm also a co-lead at HEAL initiative at the American College of Lifestyle Medicine. And HEAL stands for Health Equity Achieved via Lifestyle Medicine. And to contribute to the conversation that we're just having, I just wanted to say that ACLM has actually just launched a Bill of Rights to raise awareness of lifestyle medicine's role in type 2 diabetes, informed consent and treatment. So that is something that I highly recommend people, explore and learn more about. Thank you so much.
Thank you, Nivi. Gwenna?
I want to say I think everybody on this panel is the solution and a representation of the viewers that we have and the people that we meet. I think if we all got into a single file line, we'd all have a ton of people behind us, because if we have more plant-based doctors that were as passionate as Dr. Milton Mills, this whole medical system would be transformed. If we had people doing the reporting and as passionate as Jane, the news media would be transformed. So everybody's a representation of the solution, in my opinion. You can find me at Gwenna #1 on Instagram, and also Vegans for Black Lives Matter on Facebook.
Thank you, Gwenna. Jane?
Well, first of all, I want to give a high five to Willie for being a good sport and jumping into this den, because that takes some courage. So thank you, Willie. And of course, everything that was said, in the spirit of dialectics, argument and counter argument to reach a higher understanding of the given subject matter, not personality disputes. I do say, if you apply the reasoning that, well, people don't know, let them take their time, to any other social justice movement, you would conclude that, women wouldn't have the right to vote, et cetera, et cetera, et cetera. And so, we have to confront people nonviolently in order to wake them up. And we can't wait for the news media. In every case, when there were major social justice advancements, the news media was definitely dragging its heels and simply reflected the general opinion, never advanced it. That's why the New York Times goes back and writes apology articles about how, we dismissed the suffragette movement. Here's an article from wherever, the turn of the century, from the 19th century to the 20th century, and we were making fun of suffragettes, or we discounted all the achievements of people of color who did extraordinary things and we didn't write about them, or we didn't do their obituaries. So don't expect the news media to tell this, especially when you consider that the meat, dairy, and pharmaceuticals are the primary advertisers in advertiser-based television. You're not going to get it. They won't do it. They don't even use the word slaughterhouse. They were talking about COVID sweeping through the slaughterhouses, and most people ignored the story. And MSNBC actually did cover it, Rachel Maddow, but she didn't say the word slaughterhouse. It reminds people too much of the word slaughter. They
Right.
call it meat packing or processing facilities. And I wrote her an email. I said, I know it takes courage to even mention that there's COVID sweeping through. affecting overwhelmingly people of color. In fact, the scandal was that at one slaughterhouse company, the executives who were white were able to stay home, and all the other people had to go into these COVID hotspots, and they were dying left and right. And, this is environmental racism and dietary racism at work.
Right.
Overwhelmingly, people who are doing the killing are people of color, while, the non-minorities are running around in their Lululemon yoga pants talking about how peaceful they are while munching on a piece of bacon. So we allow them to remain in their willful denial. It's one thing saying, I don't know. It's another thing saying, I'm going to do everything I can to make sure I don't find out, which is where our society is today. You'd have to be living under a rock not to know that what's happening with these slaughterhouses is horrific. So I just say warning labels and the government subsidies, rise up. Civil rights is also animal rights, is also feminist rights, is also, and I speak as a lesbian, LGBTQ rights. When one is oppressed, all is oppressed.
Where can we find you, Jane?
All evil is that some suffering doesn't count.
Where can we find you, Jane? How can we follow you?
JaneUnchained.com.
Thank you for that. Dr. Mills?
Yeah, the only thing is, and this is the first time actually I'm going to mention Willie's name. Willie, you should go back and watch this entire broadcast, and you will see that in my comments before now, I never even mentioned you. So no one either misrepresented you or attacked you. I was actually responding to the ways in which you tried to misrepresent me. And
you're being defensive.
Can I finish my statement?
Being defensive. You're wasting time by being defensive. Why don't you
go
back
boy.
like professional?
Okay, Dr. Mills, call to action and where we can find you.
You're rude in addition to being not very bright.
All right,
I'm not saying
we're all adults here.
Mills.
Call to action and where can we follow you?
Okay. Dr. Mills, Dr. Milton Mills, plantbasednation.com.
I appreciate you joining us. Willie Flowers. You're going to close it out with the call to action and where we can find you.
The call to action is the same. I'm the head of the NAACP. I do extreme civil rights work in the state of Maryland and in this country, quite frankly. Food is a part of it, and food is a part that I take with me. I'm on the Black Veg Society of Maryland. I'm proud of that, proud to support that movement, and have done substantial work in this space to figure out what people need at the grassroots level. Like I said, we all play roles. And mine is in the community. I hope to continue to always do that and have affect change at that level. On Facebook, Willie Flowers, LinkedIn. I am also Baba of H&H on Instagram. But the overall, pitch is that if we're going to be examples of how to bring people into what we're trying to do, we can't assume and be arrogant about the information we have. And we have to soften that information in order to bring people along.
Thank you. I thank everyone for being a guest on the panel. Again, this is Naijha Speaks. Share, like, comment, and subscribe. Someone needs to hear this information. Go to NaijhaSpeaks.com. Shout out to all the sponsors for Black Veg Society. We are meeting people where they are, and that's what we're going to continue to do. So again, go to blackvegsociety.org. Thank you again. Whatever you do out there, please be kind and be safe. Thank you.
All right.